All right, guys, welcome back to Underground Science. In this video, we'll be talking about the bends, the chokes, and Caisson disease. All right, so let's go and get started. So we can take the example of diving. Okay, when you dive, right, you go underwater, and as you go more underwater, the pressure increases, right? And when pressure increases, nitrogen dissolves in your blood vessel and tissues, right? Normally. So it can dissolve in your blood vessels, nitrogen can dissolve in your blood vessels and in your tissues and that can be normal, right? So that's perfectly normal. But what happens is when you make a rapid ascent, you rapidly reduce pressure, right? Rapidly. So pressure reduces rapidly. So rapid reduction of pressure. And when you rapidly reduce pressure, remember what happened initially. You were diving, you went underwater, pressure increased and nitrogen dissolved. But if you rapidly reduce pressure by if you do a rapid ascent, right, then the nitrogen that was dissolved will rapidly come out of solution and bubbles can form due to the rapid decrease in pressure as the person was rapidly ascending, right? So So that means that if bubbles form, these bubbles can actually block off blood vessels, okay? So imagine if these bubbles form, these nitrogen bubbles, okay, so these are nitrogen bubbles. If these nitrogen bubbles form and block off blood vessels, that can lead to ischemia, right? Decreased blood flow to an organ, or even infarction if that bubble blocks off the entire blood vessel and you get no blood flow to that downstream organ, right? So imagine if this blocked off a blood vessel in the brain, for example, it can lead to ischemia of brain tissue or infarction of brain tissue or a stroke, right? If this bubble blocked off, for example, a blood vessel supplying any organ, right, which you just talked about, the main thing to know is it can lead to ischemia infarction, okay? And these bubbles not only can block off blood vessels, but if they deposit into your joints, for example, this can lead to severe joint pain, right? Severe joint pain. But let's talk about the specifics, as we mentioned in the beginning of this video, which is the bends, the chokes, and Caisson disease. Okay, these are different types. So if we talk about the bends, right, these are when the nitrogen bubbles, again, how did they form? Because of rapid ascent, right? Pressure reduced too quickly, nitrogen bubbles came out of solution, and they can deposit into joints, muscles, and tendons, which can lead to the bends. Okay, and if imagine if these nitrogen bubbles deposit in your joints, muscles, and tendons, this will lead to severe joint and limb pain. All right, so nitrogen bubbles can deposit in your joints and muscles, tendons, right? This can lead to sudden onset joint pain. Okay, so this can lead to sudden onset joint pain, and then so that's obviously going to be bad and like maybe some joints to keep in mind are your elbows, right, or your knees or your shoulders, right? If the nitrogen bubbles deposit there in those joints, you can get sudden onset joint pain, and then even like deep and aching pain too is important to remember. So deep or aching pain. All right, so that's the bends. Okay, so that's not that much um that goes into this type, right? But let's talk about the chokes now. So in this type, right, so again, rapid ascent, right? Pressure reduces too quickly, nitrogen bubbles come out of solution, all right, and they attach or they come out of solution and they block off certain blood vessels. In the chokes, they can deposit, these nitrogen bubbles can deposit and block off blood vessels in the pulmonary vasculature. Okay, so that means that the chokes can have similar symptoms as a pulmonary embolism. So you can have dyspnea or shortness of breath, chest pain, cyanosis, cough, even hemoptysis, right? For example, why would you get cyanosis, right? Because remember, the right ventricle, right, sends blood over to the lungs to get oxygenated. So then it goes to the lungs, right, to get oxygenated, then goes to the left ventricle, and then from the left ventricle, you get oxygenated blood, right? Oxygenated blood that goes into your systemic circulation, right? But if you get bubbles that form in your blood vessels right here, then of course you're not going to get enough blood flow going across your pulmonary vasculature to get oxygenated, right? Which means you won't have enough oxygenated blood coming to your left ventricle, which means less oxygenated blood will be leaving your left ventricle, which means that can lead to ischemia and cyanosis, right? So these are symptoms similar to what you would see in pulmonary embolism, right? So this would be the chokes or the pulmonary subtype, all right? And then let's move on to Caisson disease. So this is basically the chronic form, okay? So this is basically the chronic form of decompression sickness. Why does it happen? Due to repeated exposure, okay? You get recurrent nitrogen emboli, all right? So you get recurrent nitrogen bubbles, right? Repeated exposure to this sudden decrease in pressure. And if you get repeated exposure to this, recurrent nitrogen gas bubbles coming out of solution, right? This can lead to ischemia and infarction. One one important place to keep in mind, right, is infarction of your bones. Okay, so you can get avascular necrosis of the femoral head, right? For example, so you can get osteonecrosis. Okay, specifically avascular necrosis of your femoral head. All right, so osteonecrosis is something to keep in mind when talking about Caisson disease. All right. So now that we talked about the three main types, let's talk about how to manage or treat this, right? So the problem was sudden decrease in pressure. So then you'd want to increase pressure again. So you'd want the patient in a hyperbaric environment, okay, an increased pressure environment. And of course, because ischemia is in the talks, right? You'd want to also have you'd want to have oxygen therapy, right? So hyperbaric oxygen therapy. All right, so high partial pressure of oxygen in a hyperbaric environment to help redissolve the nitrogen bubbles, okay, and to increase oxygen levels in the blood because you don't want your tissues to continue being deprived of oxygen, right? And so then how would you prevent this so that this doesn't keep on happening, right? So instead of doing a rapid ascent, you do a gradual ascent, okay? So that basically allows nitrogen to safely off gas, all right? So if you do a gradual ascent, then the nitrogen bubbles won't, or the nitrogen won't come out of solution that quickly, right? So you have time to actually breathe the nitrogen off, okay? Exhale the nitrogen. Because remember, if you surface too quickly, nitrogen comes out of solution faster than you can exhale it. That's why you get gas bubbles, right, in the blood and tissues, which can cause obstruction and inflammation, as we talked about. So if you ascend gradually and slowly, right, nitrogen bubbles will come out slower than you're exhaling it, right? So you can actually exhale the nitrogen out rather than nitrogen bubbles coming out too fast, faster than you can exhale it, okay? So that's why slow ascent is important. Another cool thing that I want to throw in is when talking about prevention, right, is pre-breathing 100% oxygen, okay? So pre-breathing 100% oxygen is kind of cool. So normally, right, what you would do normally if you just breathe air, right, at sea level, we know that air has 21% oxygen, right? And then around 78% nitrogen gas, okay? And then of course the rest, we have small amounts of carbon dioxide and other gases. Okay, but if let's just focus on the oxygen and nitrogen. So if you're breathing 78% nitrogen normally, right, with every breath, then that means your blood and tissues are saturated with nitrogen. And that's fine because nitrogen is inert. Okay, and it just slowly dissolves into tissues. All right, because remember from chemistry, right? When we talked about Henry's law basically states that the amount of gas dissolved is proportional to the partial pressure of that gas. Okay, so if you have a liquid here, let's say, right? If you have a liquid here, let's say there's liquid in here. and you have like if we just do an arbitrary number, let's say you have 1,000 molecules, right? 1,000 molecules of some sort of gas, right? And then if you have that same gas, right, and that same liquid, same amount of liquid too, right? If we just keep everything the same, just so we get this example, and you have 10 molecules of gas, right, of that same gas, so everything's the same, then what Henry's law states, again, is the amount of gas dissolved. So all these gas particles, right, all these gas molecules that are above the liquid will dissolve into the liquid, right? But how much? Well, Henry's law states that the amount of gas that will dissolve into this liquid is proportional to the partial pressure. So basically proportional to the amount of molecules of gas there is. Okay, so more gas molecules will dissolve in this top example when compared to this example because there's more overall gas molecules and more partial pressure of gas. All right, so that's what Henry's law states. So the same thing can apply when talking about what we're talking about in this video, right? So if you're breathing in 78% nitrogen with every breath, right, compared to 21% oxygen, that means your blood and tissues are saturated with nitrogen, okay? And it's slowly dissolving your tissues because of Henry's law, right? The amount of gas dissolved is proportional to how many gas molecules we have. And of course, we have a lot of nitrogen gas molecules, right? So it's going to be slowly dissolving in our blood and tissues, which is normal, okay? But if you do, and that's why you have a lot of nitrogen dissolved in your blood and tissues, right? Because you're breathing in 78% nitrogen. So that if you do a rapid ascent or you suddenly decrease pressure, right, then that's why nitrogen can come out of solution and form bubbles. But if you do pre-breathing, right, so before you ascent or before you suddenly decrease pressure, right, then if you pre-breathe 100% oxygen, now you're breathing 100% oxygen, okay, and 0% nitrogen, so that you're breathing no nitrogen anymore, right? So that means if you're not breathing any nitrogen anymore because you're breathing 100% oxygen, okay, so now instead of nitrogen being dissolved into your tissues and blood, right, it's going to favor exiting your body instead, right? Because now you're breathing in no nitrogen, so there's going to be a partial pressure gradient between nitrogen in your body and out in the environment. Okay, so if you're breathing 100% oxygen and no nitrogen, then the nitrogen can come out of your tissues and actually go into your lungs, and you can exhale it out, right? So the nitrogen will come out of your tissues and out of your blood and go to your lungs, and you can exhale it. That's what off-gassing is. Okay, so if you exhale the nitrogen out, right, before your ambient pressure drops suddenly, then you don't have any nitrogen in your body to have bubble formation, so no decompression sickness. Okay, so that's what free breathing does, and that's how it can prevent decompression sickness. All right, so I hope that made a little bit of sense. That was the end of this video. Hopefully this video made a little bit of sense. Hopefully it wasn't too confusing. Thank you guys for watching, and see you guys in my future videos.